Okay, we are back. I'm very happy to have on the Goldstein on Gelt show John Goodman, who is the president and CEO of the National Center for Policy Analysis, and he's the author of the book called Priceless, Curing the Healthcare Crisis. John, real pleasure to have you.
Glad to be with you.
So based on the title of your book, there seems to be a healthcare crisis. Can you tell us about that?
Well, in the United States, we have done what other developed countries have done. That is, we have completely suppressed the price system. We've completely suppressed normal market forces. And as a consequence, no one ever really sees a real price for anything in healthcare. No doctor, no patient, no employer, no employee. All of the prices are really artificial prices. And as a consequence, we face perverse incentives when we enter the healthcare system. And when we act on those perverse incentives, we do things that make costs higher, quality lower, and access to care more difficult than otherwise would have been the case.
Okay, so were it that things were more honest in terms of pricing, what would we be seeing?
Well, in a real market, we would see competition. We would see doctors and other providers competing for patients based on price. And when they compete on price, they also compete on quality. But the mistaken view outside of the outside world of the U.S. healthcare system is that we represent some variant of capitalist medicine. We don't. We are far more like the systems of other countries than anything remotely resembling a free market. In Canada, when people get health care, it's free. In the United States, it's almost free. We only pay 10 cents out of our own pocket every time we spend $1 at the doctor's office, for example.
Okay, so let's use a comparison maybe that I'm a little more familiar with, because I've been living now in Israel about 20 years. I moved here from New York. And frankly, I understand our system here to be rather socialist, because I only pay about $1.25 every time I go see the doctor. And the system seems to be working pretty well. What's the difference between what's going on here and, let's say, what the proposals are for the future of socialized medicine in the United States?
Well, all over the world, healthcare is very, very bureaucratic. In Israel, all over Europe, in the United States, we've completely suppressed normal market forces. To see real markets in healthcare, you have to go to the periphery of the healthcare system. Wherever you see patients spending with their own money, there you'll find real markets for healthcare. In the United States, they are the market for cosmetic surgery, the market for LASIK surgery. We have walk-in clinics in the United States that charge real prices, and they post those prices. But these small little markets here and there are at the periphery of the healthcare system. Most of the time when I consume healthcare, I'm spending someone else's money, not my own money. Therefore, I have an incentive to overconsume and be wasteful. And on the provider side, the incentive is to maximize against the payment formulas. And we're all doing things perversely that make costs higher, quality lower, and access to care more difficult.
So aren't some of those so incredibly subjective that it's a little bit hard to say? For example, as a healthcare user, I always want all of the tests done just to be on the safe side.
Well, of course. And one of the things I did in Priceless was I hypothetically went through all of the ways that I can spend your money in the healthcare marketplace, even if I'm not sick. It turns out I can spend an enormous amount of money, even though I'm completely healthy. But if we all did that, we'd be spending many times the gross national product on healthcare. And that's the problem with incentives.
All right, so let's talk then about not the high net worth individual, because those people who can afford it, even in a socialized system, and I'll use Israel as the example, I'm married with 4 kids, so we do have our interactions on a pretty regular basis with doctors and hospitals. Probably once that I've been here, I was able to afford to go to a private doctor and pay what in order to pay for the service. In America, there are millions and millions and millions of people who simply don't have that possibility. Aren't they cut out of quality health care if they can't pay?
Well, most people in the United States have health insurance. And we have maybe upwards of 50 million people who are uninsured. But many of those people qualify for our Medicaid program for low-income families. And if they get sick and they need health care, they can join Medicaid. But even if they don't, we have safety net institutions that provide care for free to millions of people. So we do not have large numbers of people going without needed care. We do have people who probably delay seeing a doctor and delay the care that they need for financial reasons. but that's a different issue.
Okay, we're talking with John Goodman, who's an expert on the healthcare system. He is the CEO of the National Center for Policy Analysis, and he wrote a book called Priceless, Curing the Healthcare Crisis. John, I saw a very interesting study recently. They done it in the United States. They asked a whole lot of people what they think of Obamacare and to ask them to define what is actually going on with it now. And the fact was that very few people could really define what it was and how it was affecting their lives. Here we are in 2013. It was signed about 3 years ago. What really is happening with Obamacare?
Well, it's incredibly complex, and even the president himself doesn't explain it very well. And so you wouldn't expect the ordinary person, man in the street, to be able to understand it very well.
But you do, I hope. So you can explain it to us.
Well, we're setting up exchanges, which I think is similar to something that's going on in Israel, where people can make choices among insurance plans, health plans. And for below average income folks, there are substantial subsidies coming from the government. There's a mandate that people get insurance. There's a mandate that employers provide insurance. And there are many, many loopholes and many perverse incentives built into this new system. And people are finding out that employers have incentive not to hire workers. They have incentive to hire temporary workers instead. They are discovering that if employers are discovering that if they hire part-time workers fewer than 30 hours a week, they don't have to provide health insurance to them. So we have a huge shift to part-time work. People are responding to the new perverse incentives of the new system.
As a result of the changes, though, aren't there actually today more people who are covered and more people who are getting preventative care and more women who have access to health care at a price that's more fair?
Well, this system doesn't really kick in fully until next January. So we don't know if a lot more people are going to get insurance. It may be that more people become uninsured because employers have perverse incentives not to provide insurance, to pay a fine, which is far less expensive than the insurance itself. Individuals, now that they understand that they can get health insurance regardless of their health status for the same premium that a healthy person would pay, people have an incentive to stay uninsured until they get sick. So we'll have to wait and see just exactly how many additional people get insured, but there are all kinds of perverse incentives built into the process.
If the concept of this was to try to cover everyone, and it's really referred to, let's say, as socialized medicine, what was the point of doing it through employers instead of having the government be the one-stop shop where it pays everything? And in other words, why do you have to be employed or not?
This is a Rube Goldberg contraption. It was not put together by anyone who was making sure all the parts fit. And they wanted to get people insured, but they didn't really care how they did it. And so one way to do it is to force the employer to provide insurance. And for people who don't fit in that system, we have an expanded Medicaid system, which is for lower income folks. And for people who don't fit in that and they go on their own, they can go into the new health insurance exchanges, which is what we call managed competition. I think you have something similar to that in Israel. And so there's just different parts to the system, and there's no overriding mechanism to make sure it all fits together and works.
Okay, I hear that. So let me go back. Maybe I didn't phrase my question properly. It seems that if you want a system that will, I mean, I understand that governments are not always looking to be the most efficient, but you have millions of employers. Why get them so involved in the system and not just have everyone sign up in his local town hall to get health insurance?
Because the biggest problem in health reform is where you're going to get the money, and employers are a source of money, and so
they could just be taxed, right? In other words, tax the companies and then use that to pay the health care.
They could be taxed, and people could be taxed, but there's a limit to how much politicians were willing to raise taxes. So most of the money that's spent on health reform comes from within the system. It's not coming from outside the system. Almost half the cost of insuring young people is going to be paid for by reducing spending on older people under our Medicare program. And so they were just pulling money wherever they thought they could get it, and the employer mandate was part of that.
A lot of sort of the doomsayers, when you mentioned this about older people losing health benefits, they talk about these kind of committees that decide that so-and-so doesn't have the right to live. Do you see that's where we're going?
Well, I don't think we'll do anything quite that crude. But we are going to move in the direction of the British system of deciding whether certain procedures are worth their cost. And we might well be in a situation where some national committee is deciding that a cancer drug, for example, is not worth the cost, what it costs in terms of the extra months of life that it is expected to buy. I think we're moving there.
Oh, okay, so presuming that we're being listened to, you and I, if you could give some suggestions for how the government could maybe switch tracks, what would be some of the top things they should be doing now in order to get this to get the system set up? Or are there countries perhaps that we should be emulating?
Well, the easiest way to get universal coverage without creating tons of perverse incentives and without going through a shell game is just to give every individual a fixed refundable tax credit and every family a tax credit for the purchase of private insurance. I think we in the United States could have $2,500 per year for adults, $8,000 a year for a family of four. That's a tax credit to apply to private insurance. If the family doesn't want to do that, I would let them buy into Medicaid, which again is our program for low-income folks, but I would let everybody buy into that program if they wanted to with their tax credit. And if people turn us down and they refuse the tax credit, I would put the money in a local safety net institution. So if they go in the hospital and they can't pay their bills, there will be money there for them.
And what about people who are uninsurable or too expensive to insure?
I would give everyone a one-time opportunity to become insured, but I wouldn't let them go for years without insurance and then enter the system without medical underwriting.
Doesn't that then mean, so let's say, all the tens of millions of people who don't really feel like getting insured, they'll end up getting sick and then we're just leaving them on their own?
No, we won't leave them on their own, but we're not going to let them into the pool, or I wouldn't let them into the pool without any financial penalty. So if you decide not to insure and you consume all your income and then you get sick and now you went into the insurance pool, I would charge you a hefty premium to do that so that we discourage that kind of behavior.
Isn't this kind of similar to what Obamacare is talking about, which is they'll penalize people who don't sign up for insurance at, I think, 1% of their income?
The Obamacare strategy is to impose a mandate on people. The thing I don't like about the mandate is then you have to go on to say what insurance people have to buy, and then the special interests get to lobby and get their procedures covered by the mandate. I would rather just have the whole thing be financial. You get a tax subsidy if you buy insurance. If you don't buy the insurance, you're going to pay higher taxes, and we don't really need to go beyond that.
Mm-hmm. I hear. I think it's the way that governments tend to affect policy.
Well, once the government, what I'm describing to you, by the way, is called defined contribution. In other words, the government gives you a certain amount of money, and the market competes to see what it can provide for that sum of money. And what Obamacare does is its approach is called defined benefit. In other words, they require you to have insurance with a lot of benefits, all enumerated, and then they have to worry about how you're going to pay for it.
I hear. Okay. Well, it looks like it's a little bit of a tricky situation, and we are, of course, out of time when it gets to be very, very interesting. We've been talking to John Goodman, who is the head of the National Center for Policy Analysis. He's also the author of a book called Priceless, Curing the Healthcare Crisis. John, in the last few seconds, can you just tell people, how can they follow your work?
Well, go to John Goodman's Health Policy blog, and you'll find all kinds of interesting things on health policy. And if you're interested in public policies other than health, go to the ncpa.org website.
Okay, and we'll put links to those on our show notes at goldsteinongelt.com. John Goodman, thanks so much for your time.
Glad to be with you.
You've been listening to the Goldstein on Gelt Show with money maven Doug Goldstein. Doug's weekly radio show is heard around the world, but if you miss it, you can download the podcast at www.goldsteinongelt.com. The Goldstein on Gelt Show gives you up-to-date financial ideas so you can get on the path to financial freedom. If you'd like your questions answered on the air or off, send Doug an email to doug@profile-financial.com. It's your money for your future, so join Doug every week to build your wealth on the Goldstein on Gelt Show.